Hello, and welcome to today's video about the 10 silent stroke signs you should never ignore. Did you know that a stroke does not always cause symptoms? A stroke, also known as a cerebrovascular accident, CVA, is one of the leading causes of death in the United States each year. Strokes affect over 795,000 people each year, with the vast majority, roughly 87%, caused by a blockage in an artery that prevents blood from reaching the brain. It is critical to seek medical attention as soon as possible after this blockage occurs. Delay increases the risk of permanent damage because the oxygen-deprived brain region can die. We've all heard of the classic stroke symptoms, right? However, a refresher is always beneficial. Skin sensitivity, numbness in the extremities and face, speech issues, including slurring, one-sided body weakness, imbalance, and difficulty swallowing, are just a few of the symptoms of a cerebrovascular accident. Make sure to watch until the end, because there is a list of 10 signs of a silent stroke that many people ignore, and you are probably unaware of them. Remember the acronym FAST to quickly identify common stroke symptoms for quick and easy detection. If face, ask the person to smile. If only one side of their face responds or appears paralyzed, there may be a problem. A arm, ask for a hug and notice if one arm appears weak or does not. Lift, indicating a potential problem. S speech, ask the person to sing a song or say a simple sentence and listen to their speech. If they can't or speak slowly, this is another sign of a stroke. T time, if you notice any of these symptoms, call 911 or take the person to a doctor right away. Time is critical in the C situations, and the longer you wait, the more likely irreversible damage will occur. Now that you've been reminded and know how to recognize the classic symptoms of a stroke, let's talk about silent strokes, which, according to some studies, account for the vast majority of stroke cases in the United States. This means that the majority of people have it but are unaware of it, and thus do not seek treatment. It is critical to stay informed, especially since untreated strokes are a leading cause of dementia. Let's get started with the 10 symptoms of a silent stroke, but first, please help us out by liking this video. Subscribe and turn on the notification bell to stay up to date on our latest content. Share the video with your friends and family to educate them on silent stroke prevention, the most effective way to avoid CVA, and many lives can be saved with your assistance. Sudden drowsiness. While drowsiness is frequently associated with physical fatigue, long work hours, or sleepless nights, drowsiness caused by a stroke is distinct. It appears unexpectedly, with no prior warning or apparent cause. When this occurs, the individual's drowsiness persists, and they may even fall asleep suddenly, even during a conversation, and fail to awaken. Vomiting and nausea. Another sign is vomiting and nausea, especially when accompanied by dizziness or vertigo. It differs from other types of illnesses in that nausea caused by a stroke typically appears without stomach pain or diarrhea. Seizures. Another symptom of a stroke that is sometimes overlooked is seizures. Some stroke cases can manifest as seizures, so it's critical to take note if an adult who hasn't previously been diagnosed with epilepsy has a seizure. Hiccups. Surprisingly, hiccups can be a symptom of a stroke, particularly those that last for several hours or even days. If someone experiences prolonged hiccups, along with other stroke symptoms, such as numbness or weakness on one side of the body, they should seek immediate medical attention. Strokes can cause pain that is episodic, transient, or persistent. This pain can affect the face, a specific limb, or even the entire body. It can be a precursor to other symptoms, such as weakness in the affected limb. Due to increased pressure inside the skull, the pain can sometimes manifest as a headache. Fainting is one of the most common symptoms that is frequently overlooked. Because there are many conditions that can cause fainting, see a doctor if you or a family member faints, especially if that person has a risk factor that increases the chances of having a stroke. Memory loss. Another common symptom associated with strokes is memory loss. If you find yourself unable to recall specific parts of your day, or if you arrive at a destination and can't remember how you got there, you should see a doctor right away. An even more concerning symptom is the sudden inability to form new memories following the dizziness is a symptom that many people overlook. However, it is critical to recognize that strokes can cause dizziness. Such symptoms should never be ignored, so stay alert and vigilant at all times. Disorientation. If you have difficulty orienting yourself in terms of time, location, or memory, this could be a sign of a stroke. Such disorientation frequently leads to a loss of short-term memory. It is critical to see a doctor as soon as you notice any symptoms. Stroke can cause psychotic episodes, which are neuropsychiatric manifestations. Individuals with only these episodes as the sole symptom of a stroke have been reported in some cases. It's important to note that these symptoms frequently appear unexpectedly and without warning. Most affected people do not have any prior medical conditions or histories that would justify such episodes. Maintain constant vigilance. Now that we've covered the symptoms of a stroke, let's look at the causes of a cerebrovascular accident and stroke treatments. High blood pressure is one of the most common and well-known causes of a stroke. High blood pressure raises the risk of having a stroke by 2 to 4 times. Heart diseases, particularly arrhythmias, are another common cause. Atrial fibrillation is the most common arrhythmia associated with strokes, and it can increase the risk of a stroke by up to 6 times. Strokes are caused by more than just arrhythmias. A variety of other conditions can also contribute to this disease. Strokes can be caused by a weak heart, a dilated heart, or even blood clots. Smoking significantly raises the risk of having a stroke. Smokers' risk of having a stroke doubles, and their risk of having a hemorrhagic stroke quadruples. This increased risk is due to the inflammation caused by smoking, as well as the increased risk of aneurysms. Diabetes, not surprisingly, is another common cause. Elevated blood sugar levels can cause blood vessels throughout our bodies to weaken. High cholesterol levels are also a major cause of strokes. Obesity and a sedentary lifestyle also play important roles. Both are linked to hypertension, heart disease, and other previously mentioned symptoms. So, how do you treat a stroke? When dealing with a stroke, both the stage and the symptoms are important in determining the treatment. The first step is to stop the stroke, then address its aftereffects, and finally take steps to prevent future occurrences. Each situation is different, with silent strokes posing unique challenges. The doctor must weigh the risks and benefits of each treatment option in terms of preventing future silent strokes. Proactive measures have a significant impact. The key is to keep the associated risk factors under control. It is possible to prevent 9 out of every 10 strokes simply by managing these risk factors. Using aspirin immediately after a stroke is one of the possible treatments. However, if you suspect you are having a stroke, seek medical attention before taking aspirin. The medication helps to prevent stroke recurrence and lessens the severity of subsequent strokes in the patient. Hypertension treatment is also an excellent way to help prevent strokes. Controlling blood pressure is a critical factor. As previously stated, identifying and treating arrhythmias is critical. Arrhythmia is one of the leading causes of stroke. So, if you get proper treatment for arrhythmia and improve from it, your chances of having another stroke drop dramatically. In such cases, anticoagulant medications are frequently prescribed and are beneficial. Furthermore, controlling cholesterol is critical. Remember that lower LDL bad cholesterol levels combined with higher HDL good cholesterol levels are desirable for optimal health. Surgical interventions such as angioplasty or cleaning the affected site may be recommended for those who have experienced a blockage. Finally, developing healthier habits is the most effective way to alleviate stroke fears. A lighter, healthier, and more active lifestyle contributes to a healthier body with fewer risk factors. In other words, eat a healthy diet, exercise regularly, and constantly monitor and manage your symptoms under the supervision of a healthcare professional. Please give this video a thumbs up if you enjoyed it. Remember to share it with your loved ones so they are aware of the 10 warning signs of a silent stroke. If you're new to our channel, please subscribe to help us grow and activate the notification bell so you don't miss out on our next video. We're curious if you're aware of these silent signs of a stroke. Please share your thoughts in the comments section below. Before you leave, you might notice some other useful videos appear on your screen right now. To continue your knowledge journey with us, feel free to click on any of them or, even better, watch both. Thank you for taking the time to watch. See you in the following video. Bye.